Welcome back, animal lovers, to Awakening with Your Animal Family. I am your host, Dr. Alan Schoen, and tonight's topic is really incredible. Talk about bringing oxygen back into the breath of life. We're going to be talking about ozone therapy. And I'm really honored today to have a dear friend and colleague, Dr. Marlene Siegel, explaining this. Now, Marlene or Dr. Siegel, I don't know anyone right now who's doing more advanced and more varied techniques with ozone therapy here in North America than Marlene. And I'm so grateful that she agreed to come on the show and explain all of this. So without further ado, because Marlene has an incredibly great slide presentation where she's going to be sharing some of the most amazing cases where ozone therapy is helping, where again, where things, approaches in conventional medicine didn't work or are having side effects, here we have another great approach. So welcome, Dr. Marlene Siegel, and introduce yourself about a little bit about your background here.
Well, thank you very much. I'm so excited to be in with your audience and of course with you. I love being with you. So I've been doing veterinary medicine for rounding 40 years now. And about 20 years ago, I had a life-altering experience that made me leave that Western sandbox and explore other options. We'll talk about that in a few minutes, but it was that impetus that really, I think all of us experience it in a different way. Some people have health challenges and some people have health challenges of people that they love, but something that makes you wake up. We're on Awakening TV, right? Something that makes you wake up and realize that you got to do something else. And that's what happened to me. I'll share my story in a couple of seconds. And it was that change, that moment in my life where everything became different. And I'm so grateful for that.
Yeah, it's what you're saying. It's amazing. So many veterinarians and so many animal lovers that I know, it is usually one particular moment and you go, oh my God, there's more to healing than just medications and surgery. And that opens the doorway and the gateways to exploring. And once we take those blinders off, then we start going, oh, what about this? What about this? And as I've discussed in previous episodes, I go through a certain number of criteria to see if I think one is valid and it's reproducible and it has a scientific basis. And when I looked at all of that, I found that ozone therapy was one of those. And actually, when I was using it 25 years ago, wow, the machinery wasn't as advanced as now, and it wasn't as practical as now. You know, we were having like bags that we put the dog in and have the oxygen go through the skin. But because of the hair, it didn't work that well. And there were all these other challenges. So it was helping, but not dramatically enough. And one of the other criteria that I use is it practical? And with just the bag, it wasn't that practical. So I'm really interested to hear now, if you can explain simply to our audience, how does it work? How does ozone therapy work in animals? Well, and then we can go into the different ways that it's administered and things like that.
Okay, well, let's go ahead and start our presentation. And
yep, sounds good. Take it away.
And answer all those questions. So this is me. I would like to offer my contact information. On the left-hand side, the holistic-healing-vet.com is a free ebook that is available to anybody who wants to download it. And I'm going to go through the 6 steps to healing a little bit later in the presentation. And that's the link to be able to get that for yourself. And on the right-hand side is my website, my office phone number, and the EvoLove Raw is the raw food company that I own. And so now you have a way of getting hold of me. Whoops, that wasn't supposed to happen. Okay, play slideshow. All right. Why is that happening? All right. No, all right. This did not happen during rehearsal, did it?
Technology.
You know what? I know why. Sorry, guys. I know.
So while you're getting that,
All right, we're all set.
you
So
got it. Okay.
there's my contact information. And like we said, we're going to talk about ozone today. But before we actually get into ozone, it's really important that we understand the times that we're in. We have a pill for almost every ill in veterinary medicine, and I think the same applies for the human side. And there's a diet for almost every disease. And yet we're seeing illness rates higher than we've ever seen before. Cancer rates in dogs right now are 1 out of 1.65. That's almost 100% of dogs getting cancer. Cats are 1 out of 3, and I think that's an underreported number. But if we include obesity, autoimmune disease, arthritis, allergies, any kind of gastrointestinal disease, it's nearly 100% of our animals are showing some form of illness right now. So it's really important that we look at how to do something different. And if you don't mind, you asked me the question earlier about why did I get into this? And I'd like to share my story. This is my youngest daughter, Demi, and she's riding Lily LaCrue, our English show horse. They had an accident in the show ring where Lily reared in the air, and my daughter was literally hanging from the reins, literally, and she was pulling the horse over backwards. We know the number one cause of a rider's death is a horse falling on them and crushing them. So I had a 50-pound child and a 1,400-pound horse. Somehow Lily, as she knew she was being pulled over and she knew what side my daughter was falling to, she tried to push herself as hard as she could and fall in the opposite direction of my daughter. When Lily hit the ground, that thud reverberates. I can feel it now. Just it reverberates through my body. And you couldn't see space between my daughter and the horse. Lily caught her breath and she struggled to her feet and my daughter wasn't moving. So I ended up jumping over the rail and I'm running towards my daughter. I have no idea what I'm going to find when I get there. And by the grace of God, the only thing that she hurt was her pride. However, that wasn't the end of the story. And I had equine vets come out and look at her because she had several more incidences back at our training barn. And they said to me, Dr. Siegel, we're really sorry. We don't know exactly what is wrong with Lily, but she's not safe to ride. She'll never be shown again. And here are your two choices. You can put her out to pasture and retire her, or you can put her down. And it was those words that woke something up in me. It was like this feeling that just because you don't know the answer doesn't mean it doesn't exist. And so this burning desire to find the answers, I knew there were other answers out there. Just because they didn't know and because I didn't know at the time didn't mean it didn't exist. And that started my quest. And it was really neat that 5 months later, after being told she'd never be ridden safely and she would never be shown again, this little duo went on to win the United States Youth National Championship, which is the most prestigious youth rider show in the entire country. And that was Demi on the side after she won her reserve championship. So what I would like everybody to get from this story is that if you or someone you know or someone you love is ever told there's nothing more that can be done, that's not true. There's always something that can be done. And it's just calling you up to say, you need to dig a little deeper and find the answers.
That's great.
Mhm.
You know, I always love to hear the stories of other veterinarians, how we've gotten into this, going beyond conventional medicine and looking at other approaches. So thanks for sharing that. And
Yeah.
so next on this, okay, if you can just share your approach now, because each one of us has also taken our journeys in slightly different directions. I'm sharing on this whole TV show, my approach, and which you and I were pretty much in alignment. And as you were saying, I was one of your mentors.
Yeah.
And then we take it in slightly different directions. So yeah, if you can just share a little bit about your approach and how ozone fits into that, and then that will be the natural flow of the oxygen and ozone in this episode.
Absolutely. Well, one of the things I discovered that really also lit my fire was that our animals currently are dying between 8 and 12 years of age. And I learned that there are animals living into their 30s. So there's a cat in the World Guinness Book of Record that clocked in at 38 years and 3 days. And there was another cat that was 34 years of age. So we absolutely are not letting these animals live out their life expectancy. So this is a 6-step approach that I use, and it's really simple. It applies to every single case I do, and I hope will apply to everything that you guys do in the future as well. So step number 1 is we got to stop polluting the body. We cannot continue to do the toxic things, whether it's the toxic food, the toxic water, the toxic household environment, the air quality, the chemicals that we're spraying, the EMF that we're exposed to, and of course, don't forget the ants that live in our brain are the automatic negative thoughts. So number 1, we really have to address pollution. Number 2 is we have to make sure that the body has all the essential nutrients that it needs to do its job. The essential nutrients are those nutrients that the body cannot manufacture on its own. You have to eat them. And our food's been nutrient depleted since the 1930s. So we really have to know what are those key nutrients. It's not every willy-nilly thing that's out there. It's those essential nutrients that the body needs to run its metabolic pathways. The third major step is to heal the leaky gut. And I'm hoping that everybody on this call already understands what leaky gut is, but it's where those membranes that are holding everything together in your gut, and they act like a sieve to allow certain things in and keep everything else out. We have to make sure that gut is in integrity. The fourth step is doing detoxification. So there's 6 organs of elimination. You have your kidneys, your colon, your lungs, your liver, your skin, and your lymphatics. And this is where ozone plays a major role because it does a lot of work in multiple systems with detoxification. Number 5 is all about the mitochondria. And at the end of the day, the mitochondria are our powerhouses. It's what runs the energy of our body. So if you don't have good functioning mitochondria, your body doesn't have the energy to actually run all its metabolic pathways because we're really a big machine. And so if you think of it that way, would your car run without gasoline in it? Or if you only had a little bit of gas, you'd only go a little ways. Think about that as our mitochondria are what run the energy systems of our body. So we really need to have them we need to have them working well. And again, ozone plays a major role in helping mitochondria. And my 6th step is clearing trapped emotions.
That's great. Thanks. Yeah, in some of the episodes, we've been talking about that. We talked about EMF, we talked about environmental pollutants, we talked about nutrition. So it's nice to see we're on the same wavelength and with the approach.
And this ties it all together because it's not one thing that got us sick or our pets, and it's not one thing that's going to get us out of it. It's really developing a lifestyle that allows you to live the healthiest life possible. And that means we have to address all 6 of these areas.
Yeah. And, when you're mentioning about the age, so much of my veterinary practice was clients coming to me saying, my dog's 10, 12 years of age, and my veterinarian just recommended euthanasia. And my practice for 40 years was like, no, let's see what else we can do. And that's the enthusiasm that I think really high quality, holistic, integrative veterinarians, what we have this excitement, joie de la vie, saying, what else can we do? Because we've been educated and aware that there are so many different options.
Well, I think one of the major problems that the traditional veterinarians or the allopathic veterinarians run into is they literally run out of a toolkit. If it's not an antibiotic and it's not a steroid, and it's not a non-steroidal anti-inflammatory, and you can't cut it out, burn it out, nuke it out, they don't know what else that they can do. They literally don't have any other tools. And that's all they were taught. So, we all will agree that veterinarians are the most amazing people in the entire world. And they mean so well. I've never met a veterinarian that doesn't have good intentions. But you know what you know, and you don't know what you don't know. So I was in that same category until something happened, Lily, for me, that said, that's not enough. It's not acceptable to say that there's nothing else that I can do. This horse pulled it out of me and said, find more. And I think that's happening all over the world right now. We have so many things that look like doom and gloom, but then we have all these amazing solutions that are coming out, and they're coming out to meet the needs of today. So it's almost like as hard as it gets and as dismal as it gets, there's also an equal balance of solutions if you choose to find them.
Yeah, and that's what Awake TV is all about. Awake TV is about raising the vibration of humanity and, sharing it from so many different arenas. And mine happens to be from the holistic integrative approach. And with my new vision of calm, the conscious animal lovers movement, it's bringing it out there, harnessing this power of the love of animals, from the veterinarians to our staff to all animal lovers, to bring that into a movement showing there's a much more positive, loving, caring, harmonious way for us to create a healthier and happier world. So thanks for being part of that.
Oh, I love
Now,
it. Thank you for doing it. So let's talk a
yeah,
little bit more about ozone, because
yeah, if you can explain a little bit about how ozone actually works now.
okay, so as we talked about the roots of disease, we can see that the mitochondria is in the center of everything, right? And it's all about turning the mitochondria back on. Everything in the body communicates and relays information back to this mitochondria, from the microbiome, the good bacteria, the types of parasites, the fungi, the all the different organisms that are there, all have this two-way communication to the mitochondria. And it's so interesting that we think that we're running the ship. It's really all these microorganisms that are taking the cues from what we are telling them. And the way we're telling them is through the neurotransmitters that we are creating based on what we see, interpreting it, and what we think and how we're responding to things. We, in response to every thought that you have, good, bad, or indifferent, we create neurotransmitters. And they are what go down and signal all these organisms. We're 10 to 1 more bacteria than we are human cells, and we're 100 to 1 more mitochondria than we are human cells. So we really have to pay attention to how are we taking care of these guys. And one of the best ways we can do that is through ozone. So ozone is it's a gas that is literally formed by the universe in the stratosphere. So when a lightning storm happens, you have lightning in the form of energy that strikes oxygen molecules, and it causes them to split apart. So that's what we see right here. The oxygen molecules is splitting apart. And when they come back together, some of them will come back together as oxygen, and some will come together as ozone, which is 3 oxygen molecules that come together. But that's not stable, so it doesn't want to stay in that form for very long. What's really interesting is that I've noticed when I was a kid and we'd go outside after a good thunderstorm and lightning and all that, you could smell that clean, fresh smell in the air. I haven't smelled that in years. So it's an energized form of oxygen. It's not stable. It's 3 oxygens sharing 1 electron. And it's the most powerful sterilizer in the world. Like nothing beats it. We just had a kitty cat right before I came on the show that was blocked. He couldn't pee. And we unblocked him, have a catheter in his urethra. And instead of putting him on antibiotics, I put ozone into his bladder to kill all the bacteria that's in there so he doesn't have to go on an antibiotic. So I do want to mention, though, that the ozone that's formed in the stratosphere is a healthy ozone, but when it forms because of pollution, like nitrous oxide coming out of our cars and creating that pollution, and when the sunlight hits that, it creates ozone, but that's not the healthy ozone that we're talking about. So rule of thumb here, stop polluting the earth. Let's decrease the amount of fossil fuel emissions because they are not good for us. Now, for any veterinarian or medical person, they would look at this and they would not sleep for days. This is the Krebs cycle, and all it does is represents some of the metabolic pathways that are occurring in our body. All I want you to really see is that there's a bunch of these NAD to NADH reactions. This is literally occurring at our cellular level, guys. And ozone helps to drive this reaction to make more of the good stuff and less of the bad stuff. So what are some of the physiological effects of ozone? Well, it increases the free radical scavenger. So we know right now that a lot of the free radicals are what causes so much damage in our body. Ozone helps to reduce them. It selectively kills the diseased cell. So when we use it intravenously or in other modalities, It actually finds the bad cells and helps them to die. It is more oxygen into the body, which we know oxygen helps to kill the things that don't live in good oxygen. A lot of our pathogens live in an anaerobic environment, and when you add oxygen, they don't like that. I'm going to skip through some of these. The NRF2 is interesting. Get a little nerdy here, but the NRF2 turns on over 200 anti-inflammatory pathways. So just by using ozone in any way that you put it into the body, it's turning on over 200 anti-inflammatory pathways. It helps the Krebs cycle to work faster, so it makes more energy for our bodies. It helps to increase oxygen getting to our tissues. Skip a couple of these on the transport systems. It makes the red blood cells more pliable, and I'll show you some live blood where I'll demonstrate that. So certainly breaking down petroleums and toxins, and then helping to increase the amount of your body being able to eat up bad things. And like I said earlier, it's germicidal. And this is an interesting finding that we discovered kind of by accident, and then I found in the literature, is that some of these animals, when we give them the ozone, they feel better. And then we found some studies where they actually showed that happened in people. It actually gave them a feeling of euphoria. So I thought that was pretty good.
I actually have that experience myself because I use ozone in different forms, drinking and everything for my own health.
Yes.
And it's absolutely great and does make you feel better. And there are different ways to administer it, and you'll be going over that in some of your cases. So
Absolutely.
now to really get to the meat of this, which is great, is Marlene has offered to share some of our best cases. So our audience, we can get a real feel for actual hands-on cases, and the ones that you're sharing are absolutely amazing. So let's start with Holly.
Okay, so I picked a wide range of types of cases, so it would relate to everybody that was on this call. So allergic skin disease, next to cancer, is probably the thing that we see the most. So Miss Holly was only 4 years old, and she had been to multiple veterinarians. Her owner had spent thousands and thousands of dollars, and she would get slightly better, and then she would relapse. So by the time I saw her, her body, entire body, looked like it was the moon. There were craters all over her. There wasn't a spot on this dog that didn't have ulcers and erosions and scabs, and she was so itchy. She was miserable. So we did a full workup. We did blood work. We did skin biopsies, histopathology, cultures, and we got a definitive answer of allergic skin disease. So we changed her diet. We went through 6 principles, and we changed her diet and gave her the essential nutrients. We reduced the inflammation with a variety of things, including ozone. And this was her skin in 3 weeks. This dog had not looked like this for over 2.5, almost 3 years. And she was totally cleared up. All of her itching went away, and she looked like a normal dog. It was unbelievable how quickly. Her itching was actually gone within the first 48 hours. And then the rest was just very fast healing. So anybody who has an animal with allergies, it is really due to inflammation. And make sure you take a look at what your pets are eating, what they're drinking, what their environment's like, and heal that gut. And this can happen as well. We have case after case after case of this. I'm going to do a cancer case right now. This is Ratchet. Ratchet came to me literally looking like that. That was the picture of him when he presented. And he had been at a referral center where they had diagnosed him with an ultrasound and needle aspirates of his spleen. And the diagnosis came back splenic lymphoma. It's a bad disease, and most don't recover from this. So we started this is the ultrasound. And I know you guys aren't ultrasonographers, but this spleen goes from here to here. It's triple what it should be in size. And all these little splotchy holes in here were all where the cancer was infiltrating the liver. This was his live blood. Now, live blood is where we take a drop of blood and we put it on a microscope slide and we look at it. We don't put any stains or anything on it. And your red blood cells are important because they're supposed to be round, and they take oxygen up through their surface membrane. They deliver that to the tissue, and then they pick up the waste products from the tissue and deliver that, all those waste products, out the organs of elimination. So it's really important that they be separated and individual. And look at his blood. This was sludge. It wasn't even looking like blood. It was literally sludge. So we worked on him. It took us 3 weeks, but on day 20, this is what his blood started to look like. And this is where we could see the change in him. He really had a dramatic improvement. But now you can see that his red blood cells are actually identifiable. So just to graphically show you again at presentation, and then 20 days later, and we treated him about, in the beginning, 4 days a week, and then we went down to 2 days a week. So here he is. Ratchet actually has his own Instagram page. He has his own Facebook page. He is very popular. And every week he came in, he had his tuxedo on. And so his parents posted that he was coming in at the 10-week mark to repeat the ultrasound. We were going to see how we were doing. He obviously is thriving. Look at how handsome he is. Totally different dog. And here was his ultrasound. And now this is the size of his spleen back to normal, and all evidence of the cancer was gone. When we sent this to the radiologist, at first he said, oh, there must have been a mistake in his diagnosis, because we would not have gotten a normal spleen without, if he really had that kind of a cancer. And so I went and got his original ultrasounds, and I sent that to my radiologist, and he goes, oh, well, apparently he did have that cancer. And I presume that you had him on chemo, and that's why he got better. And I explained to him what we actually did. And all he could say was, wow, pretty profound. And this was the morning that we got to celebrate his cancer-free status. And it's been over a year. We just last month celebrated his 1-year anniversary, and we check him periodically. He is still thriving and cancer-free. Yay.
Hey,
I know y'all are applauding
great.
out there.
These are really great examples.
Yeah, if you go on my Facebook page, his parents have posted many, many stories about this.
Huh.
So this is Tucker. Tucker was 2.5 years old when he came to us. He was referred by another veterinarian, and he was not using his front leg, and he was very painful, and he was diagnosed with an osteosarcoma, which is a bone cancer. Here is his radiographs. You can see the swelling out here, very profound, and he would not let you touch it. It really hurt. In November, we could see that the hole, we were already treating him, and it looked like the hole was getting worse, but by now the swelling had gone down. He's using his leg. He's acting fantastic. We kept treating him. The MAHT stands for major autohemotherapy. It's a term that we use when we draw a patient's blood, we mix it with ozone, we put it through an ultraviolet irradiation, and then we put it back into the patient. So this is intravenous ozone. And then we did something called photobiomodulation, which I'm hoping we'll do another show on all by itself, because it's amazing. These are different laser lights that are going intravenously. And we did all this, and in January, remember we started in September, in January, he's still walking great, acting fine. We repeat the radiographs, and this bone is filling in with normal bone. We sent it to the radiologist, and they confirmed that the tumor had resolved. So he continues also. We're out a year on him, and he is still cancer-free as well. So that
is so amazing, because osteosarcoma is one of the absolute worst diagnoses you can have in veterinary medicine.
Yeah.
And I've used different approaches. My last 2 rescue golden retrievers at 15, 16, both died of that. I kept them going for quite a while with the therapies I had available back then. But, supplements and nutrition and Chinese herbs and everything. But, boy, I wish I had some of these techniques around then.
It's just so rewarding. So here you see the bones filled in, it's remodeled itself, and he continues to just have an amazing life. There he is, such a handsome boy. That's Tucker. Now we're going to switch gears, and we're going to go to chronic inflammatory diseases. This is Rocco, and Rocco came to me because he developed a head tilt. Now he'd had chronic skin problems, chronic ear problems his whole life. He was a rescue dog. but he started having this head tilt, as you can see in the video, and it got worse and worse and worse. And they were at a referral center and they just kept giving him more drugs and he just kept getting worse. So they brought him to me and I didn't even bother dealing with the ear infection. I just went right to the inflammation. So my goal was to remove the inflammation in this dog's body and see what he did. So on the next video, this is him immediately following his first treatment. And we did a ton of things. We did chiropractic work, we did ozone, we did magnetic resonance in our magnosphere, we reset his autonomic nervous system. And you can see his head starting to get a little straighter. Like he literally starts to balance out again. And then, oops, I didn't throw it in here, but at the end of literally 6 days, he was perfectly normal. That was his video or his picture after the end of treatment. And it was about 6 or 7 days and his skin was totally cleared up too. So his owner was super excited because that was the first time he ever had clear skin. This is Ireland, one of the most common diseases that we see in some of our smaller breed dogs is degenerative disc disease or intervertebral disc disease. And it happens fairly suddenly. These guys come in acutely paralyzed. So here is Ireland on the morning that she presented, and you can see that she can't walk. This is a classic presentation for these intervertebral disc disease dogs. That's how they come in looking. And so truth be told, she was brought in to be euthanized. The owner was a nurse and didn't think that anything could be done for her. And I said, no, not on my watch. So I got him to agree to leave her with me for a couple of weeks. And he did. And this is her 3 weeks later. We used no surgery, no steroids, just our alternative therapies. And how cute is that? And she never had a relapse. We got him to feed a species appropriate diet and she just did amazing. Yay.
Yeah.
All right.
These are the ones that, you know, like in my decades of practice, this is what brings such joy, is seeing these cases that based on conventional Western medicine, the prognosis is guarded, you know, unless you do surgery, and after surgery, there's so many potential complications and everything. And here we're doing it with acupuncture, chiropractic, ozone therapy, this holistic integrative approach, which just helps make the animal healthier and helps the animal heal.
And there is so much more vibrant afterwards. So that brings us to Sammy, because I had to throw a cat in here, of course. So here's Sammy on the day of presentation. This is when she became paralyzed and they took her to their vet. Their vet referred her to a referral center. She was given a presumptive diagnosis of lymphoma in her spine. And the referral center recommended euthanasia on the spot. Well, these people weren't willing to do that. And I knew the husband from a networking group. So they brought Sammy over and we committed to 1 week. I said, just give me a week. If she makes improvement, we'll keep going. If she doesn't make improvement, we'll make a different decision. Here Sammy is on day 4. That's pretty remarkable. Like she's walking like a crab. If she never got any better than that, they would have been happy because she could use the litter box and she had quality of life. But we didn't stop there. So here is Sammy 4 weeks later. Now Sammy was 15 years old when she came to me. She is now edging into 18 or 19. And she's doing great. I see her periodically. We do little tune-ups here and there. Tammy is not very happy to see me, so we have to put her under gas anesthesia for me to work on her. Otherwise, she will eat me alive. But she's doing fantastic. And so every once a year, twice a year, something like that, she comes in, she gets her ozone therapy. We do her chiropractic, a little E-stem acupuncture, and she's doing fantastic. But they're also following the 6 principles. So she's on a good diet and she's got all her essential nutrients and we've healed her leaky gut. And then we do some of her detoxification. So this is Melvin. Melvin had a ruptured cruciate and his owner was awesome to get me the video the night that he ruptured it. He was chasing his little brother. And these guys, again, cruciate injuries are pretty classic for being 3-legged like that. This was before we were doing ozone injections in the knee. So this is him 10 weeks, no surgery, no steroids, a lot of laser therapy, a lot of magnosphere, which is our pulse electromagnetic frequencies. He had ozone, good supplementations, and at 10 weeks, and she didn't have a lot of money, so we were only treating him literally once or twice a week, very minimal, and he did fantastic. Now we have, we're going to switch gears a little bit because we see a lot of animals with poor digestive health. Little Suki had gone to an emergency clinic referral center in December of the year that Suki came to me, and severe vomiting, severe diarrhea. They diagnosed him with liver disease, and his liver enzymes were really, really high at the time. He got over that, but I think they really missed a big part of his diagnosis, and I think he really had pancreatitis. So when he came to me, it's 5 months later, the vomiting and diarrhea resolved, but he's just not doing right. So we did a live blood study. And what I want you to see is look at the background. I hope you guys can see all of this movement in the background, lots and lots of little things just bouncing around. Suki had not eaten for 7 hours, and there was tons of fat in his blood. So, and look at all the rouleau. This is where all the cells are sticky. They're not separated like they're supposed to. So we put Suki in our magnosphere, and this was Suki 24 hours later. So Suki didn't have ozone. It was before we had ozone. So look at the change in the cells in just literally 1 hour of therapy. It made that big of a difference. And then this was on day 3. Of course, we were still in the process of changing Suki's diet. We had added enzymes to break down the fats, and Suki was doing fantastic. Owner said Suki had never been more active and happier. But here's a really cool thing. When we got the blood work back, took 24 hours, Suki's triglycerides were 2,514. This is on a lab test, so I can't make this up. And then in 5 days, when we came back and redid the blood work, Suki's triglycerides were down to 125. And that was getting Suki off of processed foods, using some enzymes, the magnosphere. I think that was pretty much all we did. Remarkable improvement, and has not had another episode of vomiting or diarrhea in years. Yay.
Yeah.
That's pretty profound. How many people out in our audience have high triglycerides and would love to make that go down without drugs? Remember, I did not use any drugs on this dog. It went from 2,514 down to 125. Pretty amazing.
Well, that's the thing that I found in practice is people, so many of my clients came to me as a last resort for their dog or their cat or their monkey or their exotic or for their horse. But they were skeptical. And then when they saw what alternative complementary therapies could do for their animal and how well they improved, they said, what about me? And I go, I'm a veterinarian.
I know.
So unfortunately, I had a nice network of holistic integrative physicians, and I could say, I would go see one of these, or they could refer you to someone closer to you.
Yeah.
And then it would be, what was so funny then would be, many of my colleagues were these holistic integrative physicians, and we would get together and for meetings and say, yeah, I'm treating the dog and they're treating the people. And they go, yeah, and everyone is so much happier and healthier.
It's awesome. So in our therapies, a lot of our owners actually get to experience it as well because they're going in with their pets. And just a prelude, we're going to be talking about, I'm opening some detox centers for animals all across the country. And their pet parents are going to be able to go in and actually experience the detoxification with their pets. Pretty cool. Keep in tuned. Yeah. All right, so let's talk about ear infections, because we know that skin disease is a big deal, but ear infections, and especially chronic relapsing ear infections, is a huge issue. And we are getting to the point now where we don't use antibiotics. We'll take and flush the ears out with a wax dissolver and get all the debris out. And then we flush it with ozone. Remember, I said ozone is the best disinfectant. And so we clean all of that ear infection out, kills all the bacteria, fungi, and fungi. And then we laser the ear to help reduce the swelling and inflammation, and also with our blue light laser to further kill bacteria as a second level. And we have animals that are clearing up in 1 to 2 or sometimes 3 treatments. and not having to use antibiotics.
And that's unheard of because, I mean, you go to any veterinary hospital and there's on the shelves are all these different antimicrobials, antibiotics for ear infections, which again, they're treating the end result. And with the holistic approach, that your 6 steps, similar to what I do, is we're changing the diet, changing the environment, getting it so they're not having the infection to begin with. But
Yeah.
what's great is with the ozone, you don't even need the antibiotics in the ear.
Yeah, because when you're using an antibiotic, it's not innocuous. It's going to cause problems bigger and worse down the road. And even more scary is that we won't have antibiotics in the next 20 years. The antibiotic resistance are becoming so great right now that the CDC is actually saying that we won't have antibiotics in 20 years. So we better get in gear and find something more effective. And lo and behold, there's ozone. How crazy is that? It's been around for so long and it's coming back in vogue, but it's also coming back in a way that makes it easier, more affordable, and more effective for even pet owners to use in their own homes. So I love ear infections. It's a wonderful modality. This was a really interesting case. So this was a dog who was paralyzed, a big German Shepherd, and the referring veterinarian didn't have ozone at the time. And this dog had a very bad bladder infection. It was a Pseudomonas infection that had occurred, and this dog wasn't able to empty its bladder, so it's retaining urine. And now it had a Pseudomonas infection, which would have been fatal if there was not a way to kill the infection. So he was driving an hour to get to us. We would empty his bladder with the catheter in his penis, and then we would fill it with ozonated saline, let it sit in there for a half an hour, and then rinse it out. And the Pseudomonas infection was gone after 2 treatments. So in 2 weeks, he had no more infection. But on the day that I rechecked him, I was taking an x-ray to see if the owner was able to express the bladder. Because one of the problems for this dog was he wasn't emptying his bladder. So urine was retaining in there, and it was a breeding ground for problems. So I take the x-ray and I noticed this little spot. I just caught it on the end of the x-ray. And I decided to take a better look at that. And I found that this dog actually had an osteosarcoma, a big bad bone tumor. It was very, very advanced. Because he wasn't walking, it was something that wasn't seen. And I just luckily caught it on the x-ray when I was checking his bladder. So we started doing more ozone therapy on him and supportive care. And he lived several more months with great quality of life. And then it was time to say goodbye. But he had other problems other than just the osteosarcoma. Go ahead.
Yeah, and that's one of the things is the quality of life. You
Yes.
know, they're so often when these animals would come to us, they were having very poor quality of life and were recommended for euthanasia. And what I would always say, and what we all say, is there are no guarantees. All we can do is do our best to try to help them be as healthy and happy for as long as they possibly can be.
I actually, my intention certainly is always to see if we can get the heel. That's wonderful.
Yes.
But at minimum, we want to make the animal feel better. We want to give them some quality of life. And we want to extend that quality of life as long as possible. We're not God. We're not here to determine when somebody leaves, but we certainly know that we can make their life better. And my commitment after what I was told with Lily, there was nothing more that can be done, is I vowed I would never say that to an owner. So I always work with my clients and I ask them, what do you want? If it's time for you to say goodbye, I'm going to support you for that. But if it's not time to say goodbye and you want that one extra day, I'm here to give that to you too. So this is our last case that I'm going to share. And this was a dog that had lung cancer. The dog came in for limping on its front right shoulder. And I was really taking the x-ray to look at the shoulder, and I happened to catch a little bit of the lung in there. And I saw these white dots, and I thought, I better take a better look at that. And so we did the whole chest, and this dog had cancer everywhere. So we did about a year's worth of treating her. She was in the salt booth. She had ozone. She had CBD. She had all kinds of amazing therapies. She was here every day with her owner. And this dog had the best quality of life. She'd go for car rides with mom. She had her head out the window. She even broke out of the backyard one day and just went traveling. So she really felt good. And of course, she was on a raw diet and all the other pieces. And then when it was time to say goodbye, we were all good with that because it was just her time. But we followed her x-rays out multiple times and her tumors did not get bigger. So, and some of them actually seemed to have shrunk and even gone away. So I would call that still another success case because she was already in her mid-teens and when we diagnosed her, and she lived another full year with great quality of life and really happy. And her mom was really happy. It gave her that year that she really needed to have that quality time with her.
That's again one of the teachings I always share, and we share is like it's enjoying the moment. You know, like I had one client that came to me with their golden retriever at 10 when it was recommended for euthanasia, and you know, for severe hip dysplasia and arthritis. And every year we were doing a holistic approach, all the detox, everything. And she would say, do you think it'll make it to 11? I go, well, who knows? Enjoy the moment. And then she'd say to 12. And I said, do you think he'll make it to 13? I said, who knows? Let's enjoy the moment. Well, finally at 16, when she said, do you think he'll go to 17? We laughed, you know?
Oh, great stories. All right,
Yeah.
well, let's go into how do we use ozone because there's so many different ways that we can use ozone. I've already shown you a few cases where we used it intravenously. And what I mean by that is we draw some of the blood, we mix it with the ozone, and then we put it back into the animal. Another real popular way that we use it is called rectal insufflation. And that means we take the actual gas, we put a little catheter up the butt, and we just squirt the gas in. It's super easy. I encourage owners to even do it at home themselves. If they want to buy a ozone generator, they can do that. It's very affordable. Limb bagging, you referred to that earlier. That's where you put either a limb or the body into a bag and you pump ozone and it stays in there. I don't use that one as much because we don't want to breathe the ozone. It's really hard to get a good seal on an animal. You would want to do that outside. We lavage everything. So you can rinse it. We bubble it into a saline mixture, and then we can rinse eyes for eye infections. We talked about the ear, rinsing for ear infections, topical wounds, infections, everything gets rinsed with ozone. We had a really interesting case a couple of weeks ago with a dog that got kidney stones in both kidneys, and then one of the stones went down into the ureter. That's the pipe that leaves the kidney on its way down to the bladder, and the stone got stuck and then grew and grew and grew where it was, and it actually blocked this dog's ureter, and then the kidney got infected. So by the time she came to us, she was very, very sick, exceedingly high white blood cell count. We sent her to the University of Florida to see if we could save the kidney and reroute the ureter, but they said it was not likely to be a successful surgery, and they wanted $10,000 to do the surgery and ultimately remove the kidney. And so we decided to bring the dog back to my office, and on a Saturday night, my daughter and I were in surgery. We were going to remove the kidney, and it was truly one of the hardest surgeries and most difficult things I've ever done because as soon as I opened the dog up, this pus was just literally shooting out the kidney. It had just swollen the capsule and it literally was shooting out the kidney. And that pus was just flooding the entire abdomen. The pancreas is right next door. And so it was a mess. And we flushed her abdomen with tons of ozonated saline before we closed her back up. The next morning, we gave her ozone via the blood. So we did the major autohemotherapy. And then we did it rectally for a couple of more days after that. And this dog recovered phenomenally. She did get pancreatitis and she was over it in under 3 days. So success case. And I can tell you that there is no way that this dog would ever have recovered that well if we had not had ozone to be able to flush all of her abdomen and neutralize all that bacteria.
Oh, for sure. I mean, when you were sharing about that case earlier, without ozone, it probably wouldn't have survived.
I don't think she would have. Her
Yeah.
bite count was almost 50,000 and it was going up. So she was very, very toxic.
Now,
We have to put a feeding tube. We had
Oh,
to put a feeding tube in because she didn't even want to eat, you know, between the kidney infection and the pancreatitis. Oh, poor dog. But she's
oh yeah.
vibrating right now.
Either one of those can be a killer.
Yeah,
Yeah.
yeah. And so I'll make a presentation out of her. That was just a couple weeks ago. So that was really cool. And then another way we use ozone is to do it in sub-Q fluid. So I'm sure a lot of pet owners have had their animals have fluids under the skin. Well, why not add ozone to it? Because now you have the benefit of the ozone in addition to just the fluids. So lots, and then I mentioned it earlier, but I don't have any slides in this presentation. We inject it into joints. So for these animals that have cruciate injuries or severe arthritis, say in the knee or the shoulder, we can inject that with a mixture of nutrients and ozone. And we also use PRP. So we use some of the blood from the patient and then we activate it with laser and it's called PRP. And it actually creates stem cell reproduction. And our animals are able to literally walk off the table when we get done. And these are animals that were three-legged lame. And it lasts for a long time.
Yeah, I mean, there's so many of these newer therapies now that we can integrate and where you get the benefits of the synergy of all of them. Now, just as we're starting to run a little bit low on time, are there any contraindications or any limitations for ozone?
Used properly, I'm going to say no, but I tend to be cautious if I have something that's bleeding, like a hemangiosarcoma or a tumor that is actively bleeding, then I'm a little more cautious about using ozone during an active bleed. But once I get everything coagulated and they're stable, I have no problem using the ozone. So if it's used properly, it has virtually 100% safety.
Well, thanks for sharing all these amazing cases. It really shows everyone the potential of holistic integrative medicine, and specifically here today, about ozone therapy. So are there any final words you'd like to share as we're getting near the end of this episode?
You know, we touched upon it, you mentioned it and I mentioned it, and it's the value of having one more day. And we don't think about it at the time that we're living our lives, but if we stop and we just reflect on somebody that we've lost, somebody could be two-legged or four-legged, very dear to us, and we think about what would that be like to have one more day with that individual, and we would have tremendous value for that. Every single person I've ever mentioned that to is like, oh my God, what I wouldn't give to have that one more day. But we have that one more day now, and we need to be very grateful and conscious and live each day as if it was our last, but with joy and gratitude and compassion for others. And that's what we're doing in holistic medicine, is we're offering that one extra day. I know a lot of owners will ask me, can you make my dog live forever? Or can you make my cat live forever? And we know they're not going to live forever. None of us are going to get out of this hologram alive, right? We're all going to leave one day, but we should have the healthiest, most vibrant type of thriving in the life that we have, not just surviving. And age is not a disease. Age is something that we've been told, oh, well, it's expected my dog's getting to be 12 or 14. Well, we've already seen these animals ought to be living into their 30s. And there are examples of animals that are living into their 30s. And these are animals that had more of a prey diet, and they did intermittent fasting, and they had high intensity exercise. You know, they had a lifestyle that was conducive to that, and we've taken that away. So we need to be more conscientious to have the kind of lifestyle that helps all of us live healthier. So take your dog for a walk, go out and play, just have a lot of gratitude.
Gratitude is another one of the keys. When I talked in an earlier episode about heart math, and they show the scientific changes, the benefits of just having an attitude of gratitude. And all of that, plus the exercise, the nutrition, it's all there. And if God forbid, then we do come up with a disease, we have all these other modalities that can be a benefit, which is just great. And it warms my heart. And I'm really so grateful for you sharing such great cases today, Marlene. And it brings me joy to see what I had pioneered way back when, that veterinarians like yourself are taking it to the whole next step. And I would encourage my audience, if you need something like ozone or an integrative approach, I'm not in active veterinary practice anymore. I'd be glad to help you. If you're interested in finding out about different ozone machines for home use, you can contact me on my email address and my website. If you have a patient where after seeing these different cases, contact Marlene, see if she could help. She's down in Florida. And between us, we always have a referral list also of veterinarians in your area that may not do everything that Dr. Siegel does, but that do a certain percentage of the holistic integrative approaches. So I can't thank you enough for joining me today. And I look forward to having you on again in the future and to be co-creating so many different new options for all beings, for the benefit of all beings. So thank you so much. It is such a joy to have you.
All right, I'm going to take it off of screen sharing, and thank you so much. Had a wonderful time.
Yeah. Okay. Well, we'll be back in touch and we'll have you on more frequently. Thank you again.
Much love to everybody. Bye.
Okay. Bye for now.